Welcome to Alpha Coding Podcast, an all-access pass to medical coding and billing pro tips that help you start your week off smarter. And now, here is your host, Toni Elhoms.
Hello, everyone, and welcome to the Alpha Coding Podcast series. I am your host, Toni Elhoms. Welcome to episode 70 of the podcast. Today is May 3rd, and welcome to a brand new month. I'm so excited for today's episode because I invited a special guest to join us, and she's going to share some valuable insights on credentialing and enrollment. So before we dive into our topic, it's time for your Monday dose of positivity, the Mindset Monday tip, and it's brought to you by Careo. Is your current EHR giving you headaches and impacting your cash flow? With Careo's integrated solution, you can rest assured knowing that Careo will deliver a complete technology suite that allows providers to effortlessly manage all functions of their practice in one place. This means less paperwork, increased patient satisfaction, happier providers, and better outcomes. Visit our website, alphacodingexperts.com, and head over to the Deals and Discounts tab for a link to take advantage of exclusive pricing. So our Mindset Monday tip is all about embracing adversity. The quote I want to share with you says, "Look adversity dead in the face and say, let's go and keep moving. Get busy." And I love this quote because it's all about getting your mindset in the right place. You have to embrace the fact that adversity, struggle, challenges, they are all part of the process in leveling up. Leveling up in life requires overcoming adversity. No matter who you are, no matter what advantages you have, we're all going to have adversity that we have to overcome. And the great thing about adversity is that you learn things about yourself that you didn't know. It's very much tapping into something that's deeper within yourself. So embrace that struggle because it gives you the foundation you need to level up.
So our guest for today is Yesenia Servin, and she is in Chicago, Illinois. Yesenia is the founder of YS Credentialing and has over 20 years of experience in healthcare credentialing, contracting, and payer enrollment. Yesenia is a nationally certified credentialing specialist, as well as managed care and payer network enrollment expert. I invited Yesenia on the show today to discuss her best pro tips for navigating medical credentialing. So thank you for joining us today, Yesenia.
Thank you so much, Toni, for inviting me. I'm so glad to join you and your audience today.
Yeah, super excited to have you shed some insight on this topic. So let's dive right in and break this down for the listeners. What is credentialing and why is it so foundational to a healthcare organization?
So one thing that I found in my over 20 years of experience is that there's a term that gets interchanged a lot with enrollment, and that is credentialing. So I want to first break down the difference. So credentialing is the process of verifying a provider's credentials. We're checking their education, their training. Are they who they say they are? Is the work history legit? The certification and licensing. I mean, we've all heard of Dr. Death and what happened there and all those miscredentialing pieces. And then enrollment is the process of enrolling organizations, enrolling entities and providers with the payer network. So with those, big insurance networks and private payers. And we're enrolling them so that they'll be considered participating providers. And the goal is always that they'll be on those panels as an in-network provider because we're hoping to get those in-network reimbursement. I know that healthcare professionals in all environments usually just label it as credentialing. So we think of it as encompassing all of these things, but they are separate functions, absolutely.
That's a really great deconstruction of the process. And I think you're right that terms are used interchangeably and they can mean very different things. And yes, we've all heard of Dr. Death. Oh my goodness. So what are some of the most common issues that you see with credentialing?
I think one of the biggest is time. So having worked in various environments, large and small systems, and across the entire US, I found that there's not enough time allotted ahead of time. So sometimes leadership, hires someone on Monday, wants you to have everything 100% done by Tuesday. And that's virtually impossible. There's no way that's going to happen. So I think it's important that organizations and leadership understand that the process can take anywhere from 30 to 180 days. And it all depends on that payer, right? So they determine what that process looks like. We can provide the application as complete as possible, all those credentialing point. But again, it's understanding how that payer works and knowing that there's no way it's going to get done in that 24-hour period.
Hear you when you say that, because people come with these like completely unrealistic expectations on timelines, right? Like, I hired them, they already started, get it done.
Right. All the time. Yeah, all the time. And then I think another piece is organizations sometimes miss training their credentialing and enrollment specialists. So there's not enough provided up front, but you've been doing this forever and we're always learning. There's always so much to learn. There's always new regulations, new standards, who's supposed to adhere to them, who's coaching everybody, who's training everyone on these. So I think that's another common issue with organizations.
Yeah, I couldn't agree more. Talk to us about some of the technology solutions that help streamline the credentialing process, things like PACOS, MPDB, and CAQH. These are common things that we hear.
Right. So I remember, I'm sure you can relate, when we started, there wasn't many systems helping us. We basically figured it out, created our own checklists, used maybe Excel, maybe our notebook. And nowadays we have a lot of options, right? Where there's a lot of credentialing and enrollment software that cater to all of these tasks. So CAQH is one of the most reliable and that we've heard of, and it's accessible to everyone, right? It's a credentialing repository where we keep all the credentialing fields for providers and organizations as well. And then it keeps a lot of the documentation, all that professional documentation. So it was actually created to assist enrollment and credentialing specialists. It was supposed to eliminate a lot of redundancies. And then we have PACOS. So PACOS is the Medicare electronic portal. So that is where we will enroll and complete Medicare applications, again, for organizations and providers. So we have come a long way, because it used to be those big stack paper applications and we'd have to mail them out certified. Don't forget the certification, and, wait and count the days until they've confirmed that they received that packet of yours and then process it. So now we have all those options online. And then the National Practitioner Data Bank, which we all know as NPDB, really help assist us in credentialing. So like, are there any adverse actions against that provider? Is there a malpractice history that we need to review that's urgent in terms of providing that patient care and quality care? And those things absolutely need to be reviewed. And again, we have access to that all via the portal. So it's huge improvements in technology in the recent years. And I'm sure it's going to continue to grow this way.
Definitely. And you brought me back when you're talking about the spreadsheets and like the archaic filing systems. You've come a long way.
Yeah.
So payment methodologies are rapidly evolving. We're seeing a lot more risk-based contracts, shared savings plans, things like bundled payment programs. What trends are you seeing in the payer contracting world?
So this is a key reason why we love working with billing specialists and coding specialists, because we have to be in it together. Otherwise, we're going to be confused. So the biggest trend is the value-based payments versus the fee-for-service. So providers were used to seeing a fee schedule that says you provide this, service, so this code equals this amount. And now they're extremely worried. A lot of them are confused as like, what does this value-based mean to me? What does the contract mean to me? So that's one of the biggest worries that I see out there for organizations and providers, as the people in the background, part of the larger professionals like yourself, like billers, all of us in that revenue cycle management, we're the ones like digging in, like, okay, let me find out how it's going to impact the work I do and how I serve those providers. So that's the biggest thing right now. And then over this past season, we've grown so much in terms of understanding telehealth, what those services look like, what the reimbursement looks like, what do I need to do in terms of the credentialing contracting, where do I need to alert, these payers and directories, et cetera, et cetera.
Yes, definitely. There's so much going on and it's good. We welcome that change because the old way of doing things, the fee-for-service traditional model it's not sustainable. And I think it's really time to get serious about exploring alternatives.
Right. And I actually really like the term value-based, because that's really the ultimate goal. Like all of us, everything that we're doing is assisting physicians and providers provide value, quality services to the communities.
For sure. So this show is all about pro tips. What are your top 3 pro tips for navigating medical credentialing?
This is one of my favorite segments of yours, Toni. I love your sessions and I love the pro tips. So I'm excited to provide some of these. So before beginning the enrollment and credentialing process, I always recommend you dig in deep and do the research. A lot of times you get a stack of information or a piece of information, but really dig in, review, the legal name, what is listed on those IRS documents, what is listed on those licenses, what is listed in that NPI registration, what is listed in that PACOS information. So really dig in and get all the info for yourself. Although in some instances, organizations will say, here it is, here's the info. But, as a healthcare professional, there's always more to find. So just really dig in first and get all that information compiled. Second, identity and access. You have to enroll in identity and access. So identity and access is the CMS gatekeeper per se of the PACOS account, the NPIS account, and the NPIS is that NPI profile, and then the EHR system. So identity and access will grant you access to all of these three profiles, and every enrollment specialist that assists in any kind of government enrollment must obtain an identity and access profile. And you always use that identity and access surrogacy option. It's a little bit of a tongue twister. Third, find the tools that help you be efficient. Submit via the portals because most payers now have those portal options. Use project management tools. So create your own database if you need to, and always keep learning. And if I can, I'd like to just throw in a fourth one. Toni, is that okay?
Please.
So the fourth one is work closely and build strong relationships with the claims teams, the billing teams, the coding teams. These colleagues, are the ones that will provide the tools needed to help you prevent revenue losses. And we all are continuously learning from each other.
Those are excellent pro tips, Yesenia. It truly amazes me how few healthcare professionals really understand the impact that credentialing has on the full revenue cycle. And when you're in the trenches and you're seeing those denials, it's like, wow, you see truly how important and foundational it is to not only, facilitating the care that happens between the provider and the patient, but the sustainability of the business model.
Absolutely.
So what's your best advice for organizations that experience a lot of credentialing related denials and challenges?
I think what you just mentioned is absolutely right. So the foundations. I always ask organizations to think about the revenue cycle process as including the credentialing and enrollment. Include that as the first step. And most renderings, when you see that visual, that beautiful, cycle visual, and it's multiple colors, you'll find that they list the first step as that client intake or that client scheduling the appointment. But truly, you have to go way back, because if you don't have credentialing and enrollment at 100%, then that totally impacts your revenue cycle. And it impacts, how healthy your organization is in terms of those dollar reimbursements.
Yeah, that's great advice. So tell us about your work at YS Credentialing.
I get so excited, so I'm going to try not to talk at 100 miles a minute on this question. So I help healthcare professionals on all sides of the credentialing enrollment, so that includes providers, practice managers, billing professionals, administrators, leadership people. I help them understand how they can best build an efficient credentialing and enrollment process. I work with physicians and advanced health care providers when they're ready to start or build on their own practices. I provide credentialing and enrollment services to private entities and non-profits. In some instances, I manage all of these things for them. And in other instances, I'm just a resource. So I'm the one training, their professionals, coaching their team, making recommendations, providing tools. So I'm very excited to have a team of 5 wonderful people. So very excited to have them and continue growing.
That's super exciting. I always love to support healthcare entrepreneurs. Being an entrepreneur myself, there's so few of us, and female entrepreneurs is even better. So I'm really excited for you, Yesenia.
Thank you so much. I'm so happy to meet you and reach out to you. I'm glad that we are connected.
I know. And we'll be sending business each way. So yes. It's going to be great. So tell us what's next for you.
So I'm always researching, networking, trying to grow myself. It's healthcare. So, Toni, we're always, figuring out what we need to learn next, how we need to grow, and what area our expertise needs to be better. I am also a current faculty with Team Ed Global University. So I write curriculum and I do instructing throughout each season. Team Ed Global is the kind of organization that collaborates with every type of professional in the industry. So there's no members only. There's a lot of organizations that are very strict on that. And the difference with Team Med Global is that I get to partner with them, and just whoever wants to be part of it can be part of it. There's no restrictions. I love organizations that help us continue to grow as professionals at any level. Additionally, I do provide several professional training offerings through various platforms. I post them on LinkedIn. If anyone's willing to join me or find me on there, that would be great. I enjoy working with providers and professionals internationally as well. So I'm dipping my toe into those international waters. So that'll be fun, and continue developing great relationships with colleagues.
That's awesome, Yesenia. I'm super excited for you. And we really appreciate your insights today. Be sure to connect with Yesenia on LinkedIn. Thank you, Yesenia.
Thank you so much, Toni.
So it's time for this week's coding pro tip, and it's brought to you by Project Resume. When is the last time you had your resume updated? Your resume is literally your entry ticket to that next great opportunity. Project Resume will design a customized ATS-friendly resume to demonstrate your unique skills and experience. And even better, it's written by coders for coders. Make that investment in yourself today and visit projectresume.net and mention my code ALPHACODING for special pricing. If you have a coding related question and would like it to be featured in one of our coding pro tips, please reach out to me on LinkedIn, Facebook, Instagram, or YouTube. So this week's coding pro tip comes to us from North Carolina. Hi, Toni. Thanks for putting this show out every week. Because of you, I look forward to Mondays sipping my coffee and listening to your show. I have a follow-up question for you about your RPM episode. If we have a patient on 3 separate devices, do we get to report anything additional to cover the cost of these devices? It seems odd that we could only charge for 1 device. So first of all, thank you so much for the kind words and support of the podcast. This question actually comes up a lot, and unfortunately, the way that the guidelines are currently written, there is not a per device monitoring code. It's an all-inclusive. So even if your patient is on multiple devices, you can't charge the per device as a per device code. It actually has a maximum of 1 unit that can be reported for that calendar month. So the really important key here is that the device vendor that you select offers a selection of devices that are integrated and truly fit each patient's specific needs. So for example, one of the vendors that I've worked with has a dual blood pressure and glucometer. And so this one device takes care of 2 biometric data points. And there's so many different types of technology and sensors that can capture multiple biometric data points. So you really want to make sure that the vendor that you're using for these devices is going to provide maximum value. Please remember to hit that subscribe button now so you never miss another episode. Also, be sure to drop us a 5-star rating and review on iTunes. We really appreciate your support. So this concludes today's episode. Until next week, thank you for listening to the Alpha Coding Podcast. We'll see you next Monday.
For more information about medical coding and billing pro tips, including how to hire alpha coding experts, follow us on LinkedIn, Instagram, Facebook, YouTube, or visit our website at www.alphacodingexperts.com.